I think that a lot of patients are motivated to get implants when they're missing teeth because they miss the function of their teeth. Or it's in a smiling zone, right? And they miss that. But a lot of times it's about function. Being able to chew their food comfortably, being able to speak naturally. Those are very important functions for basic human living. And being able to restore a tooth or restore a set of teeth on 4 or 6 implants for the full lower jaw or for the full upper jaw or for the whole mouth for that matter. Patients who identify and that they need that and they come to me and we talk through how the procedure is done, the ones that have completed the treatment are just very thrilled that they can function like natural and get their smile back. And
more safe for me, very comfortable, and I was glad we did that.
We're able to replace a tooth back into normal function, and out of all the prosthetics out there, it's the most lifelike and naturally functioning than any other prosthetic, if you think about it. So I feel privileged to be able to offer that to my patients. The thing that distinguishes the way I practice implants than others is that I can take a patient who has a tooth that has to be gone and there's nothing else we can do with the tooth. We can remove that tooth. We can place the implant the same day. And then I create a custom healing abutment that covers the socket that the tooth came out of. Biology happens underneath that cap, if you will, that covers the socket. The bone remodels underneath and sticks onto the implant and integrates with the implant. And in about 3 to 4 months later, we can start the process of making a new tooth. Traditionally, we had to wait 6 months to 9 months before we could put another tooth. So we're cutting the time in half. And I just had a patient come back and tell me this feedback where he had the procedure done and he was amazed. He called us magicians that he had no pain after it. Sometimes you don't know you need an implant until we've exhausted all options to restore that tooth. And that tooth is just not fixable due to maybe a fracture on the root. Sometimes you're in pain when you need an implant, and sometimes there's no pain. There's a lot of dental problems that are silent and can give you a false sense of security. Oh, I don't need to see a dentist, I don't have any pain, I'm fine. But yeah, we identify those problems on routine examinations and every 6 months visits and x-rays and check-ins, checkups. We can check and see if there's a tooth that is cracked.
He's very professional. He doesn't do everything to the point and he's very patient. That to me is very important.